I want to talk to you a little bit about one of the most common questions that we get about implants. What do you think that is? How much do they cost, right? We've all heard that implants are expensive. Well, unfortunately, the answer is, it depends. It depends on, do you already have teeth? How much bone do you have? Is your bone any good? You have different kinds of bone, different thicknesses, some on the top and some on the bottom. The teeth are in the way. Are they infected? Do we have infection to deal with? Do we have to put bone grafts in there? And what bone graft is some mixed up powder of some bone from sometimes a pig or artificial or sometimes a cadaver that's put down those sockets to let it heal better. The other question is, are we going to use the adjacent teeth? Do we have to work around them? We're going to have to do crown and bridge work with that. Do you have dentures already? Do you want implants because you want your dentures to be tighter? Sometimes that's one of the simplest cases. One of the most common problems is upper denture fits well, lower denture just floats all over the place. In fact, in dental school, our denture professor, when he's teaching us about how to do these, he said the way you do charge for these is you charge double for the upper and you give them the lower for free. That way you can't complain about the lower one doesn't fit, because that's pretty much what happens. Your upper arch is like a horseshoe, or it's like a big U-shaped suction cup. Upper denture goes in fine. The lower is like a horseshoe. It floats all over the place a lot of times. Sometimes it's simple as just placing 2 implants on the corners with little snaps on them where it can snap in. It takes care of the problem. Some people don't want their teeth to come out. They're embarrassed about that. They want them to stay in. So what we can do then is we can sometimes put 4 implants, sometimes 6, have a bar in there, and then screw it in place, or screw them into individual little implant pieces. So unfortunately, when people ask the question, how much do implants cost? As you can see, the answer is it depends. Now, that's why we offer a complimentary consultation. Come in and talk to us. We'll take some pictures, maybe take an x-ray. Might have to do a 3D cone beam scan, which allows us to get perfectly placed implants to 1/10 of a millimeter. And for our internet patients, we offer this as a complimentary feature that will take that cone beam scan and see where we can fit implants with you. So I'd recommend that if you're curious about implants and think they might be for you, come in and see us.